want to do our best to help children and their families when they're suffering. And what we know from the scientific evidence is that the best way to do that is to use evidence-based approaches. If you want to help people, you want to help them using, practices and using programs that we know are actually going to help them. Most training programs, you get an overview of, working with children, working with adults, and largely the focus is often on adults, but our program is uniquely focused on children.
The younger you're able to intervene, the more change you'll be able to have, the more positive change you'll be able to create. If you can support a family early on, the outcomes tend to be more positive for the children.
We saw the importance on also working on prevention, because the earlier that you can work with a child and support the child through whatever he or she or they are going through, the better it's going to be for them to improve their chances of have a better life in the future.
In order to be a clinician, you need to have experience. We really believe that it's important for students to be not only learning these skills in the classroom, but also applying them in the practicum setting. There are many programs out there where the students themselves have to find the practicum settings. But we have hand-selected these programs because we believe that they will provide our students with the best training.
The practicum was my favorite part of the program. I really like the idea of being able to practice the concepts that I learned in class that week right away with my clients and my patients.
The classes are nice to have a foundation, but until you are face-to-face with a client, that's really where the learning happens. Not only are you having supervision weekly with your supervisor on site, we would then have classes where the professors were always open to doing consultation on different cases. I never felt like I was alone in doing this, and I always felt like I had extremely knowledgeable and talented people at my disposal as resources.
Our students are being sought after in the community. I'm getting calls from sites in the community who are looking for students to come and work at their agencies because the reputation of the program is growing and we're seen in a positive way in the community.
It has been one of the single most impactful periods of my life as far as growing, developing an understanding and more compassion for people. It has helped to make me a much better person, much more gracious for people that are in struggle and in difficult times.
I decided to choose this program was because it is a one-year program. It was an intense year, but I can take advantage of the time and do more things after. With this degree, I will be able to go to more spaces to provide treatment to communities that I want to work with. So this degree has inspired me to do bigger things in life.